Hello everyone, my name is Ifram Musawwir and today we will discuss about health and equity in focus, a local and global perspective. This presentation explores how unequal access to healthcare affects people's health outcomes. I will discuss a local issue in Pakistan as compare it with global situation. Explain the social factor behind these inequalities and present evidence-based solutions that can help improve health equity. Health inequity refers to unfair and avoidable differences in health among different groups of people. In this presentation, I focus on the limited access to mental health services in Pakistan as the local issue and compare it with global mental health disparities. The groups most affected include young adults, women, rural communities, and low income families. These inequalities exist because access to healthcare depends on social and economic conditions rather than medical needs alone. In Pakistan, mental health services remains limited due to several challenges. There is a shortage of trained mental health professionals. Social stigma discourages people from seeking treatment. Healthcare costs are high, and rural areas have very few mental health facilities. As a result, many people suffer from untreated anxiety and depression, receive delayed diagnosis, experience poor quality of life, and face an increased risk of suicide. According to the World Health Organization (WHO), around 24 million of people in Pakistan experience mental health problems. Globally, mental health care differs greatly between high income and low income countries. Wealthier countries usually have more psychiatrists, stronger insurance systems, community mental health programs, and digital healthcare services. In contrast, low income countries struggle with a lack of specialists, weak healthcare infrastructure, financial barriers, and low public awareness. These differences create unequal health outcomes and highlight the need for better global investment in mental health care. Mental health inequalities are strongly influenced by social determinants of health. Factors such as poverty, education, employment, gender, rural residence, and access to health information all affect whether people can receive timely diagnosis and treatment. Individuals with fewer resources often face greater barriers to health. There are practical solutions to reduce mental health inequalities. First, communities should increase mental health education through school awareness programs, social media campaigns, and community workshops to reduce stigma and improve understanding. Secondly, governments should expand access to mental health services by investing in telemedicine, opening more rural clinics, and training community healthcare workers. Together, these strategies can make mental health care more accessible and equitable. At the end, health inequalities are mainly focused by social and economic factors rather than biological differences. So, reducing these disparities requires improving healthcare access, strengthening public education, implementing supportive government policies, and encouraging community involvement. Here are some of the references. As you can see, Thank you for listening to my presentation.